Now, have you ever had a facial before?
Maybe when I was like 20
Oh, so it's a while ago.
something, over
So
30 years.
And this is a medical treatment, so I mean, you've come a long way with skincare.
This feels amazing, actually. It's so cool.
Yeah, so this is just prepping your skin for the peel and the microneedling. So I'm going to do a clay mask after this. Just work it into the skin, and then I'm going to remove it, and then I'm going to needle the skin, and then do a peel, and then the alginate mask over.
Okay. What are the frequently asked questions for this whole process that you hear?
What can I do for wrinkles? What can I do for, skin that's aging and losing its firmness? And the best thing you can do is needling, microneedling. And we have 2 levels of microneedling. Actually 3: light, intermediate, and then advanced with the radio frequency. And that you need to be numbing for an hour, because you will feel it.
And it tightens the skin?
Yep, tightens the skin. It helps reverse the fine lines and wrinkles. It helps with pore size, the sun damage, the pigmentation, texture issues, acne scarring, any kind of scarring. Needling is the most effective, because what's happening, it's remodeling the collagen. And when you scar, you produce collagen 3. And that causes a lot of that keloid type scarring. And we want collagen 1. That's that smooth collagen where there's no trace of damage done. What would happen, like if you were in the womb, and if you were to get like a cut in the womb, so what happens if they would do surgery? Do you ever know that? Have you hear of that, when they would do surgery in the womb for a baby? Well, if they were ever to get a little nick, what they have found is they heal without any scarring. That has to do with the stem cells, the type of collagen that's produced when they damage the skin, but that's only in the womb where they produce that collagen 1 if they're damaged. I think that's fascinating. Like, why can't that happen all the time?
Exactly. But this is so advanced. There's so many benefits.
Oh yeah, because you can use the radio frequency. That brings it to the whole nother level.
How many times do you get that procedure done?
3 times. You want 3 times. And then you can do it thereafter as many times as you want, but you at least want 3. So this is a vital part of the treatment. Even though it feels good, it's so important, because it's softening the tissue so you get a better needling.
It feels amazing. But it stays hydrating on the skin. It's not drying, which is really nice. So it lightly exfoliates the skin.
I will sterilize the skin after the microneedling with a TCA peel, trichloroacetic acid. So it closes up the channels and inhibits any bacteria.
And what about the pH balance of those?
We want to lower the pH when we do a peel. So I'll be using a glycolic acid toner to lower the pH. That way you get a better. And then the peel itself has a low pH.
How often can you get this done?
I know, it's lovely, isn't it? Once a month.
Once a month. That's great.
Yeah. Every time you do it, it helps build collagen. It's called the Collagen Induction Therapy.
Jody, is this good for all skin types?
If they have active rosacea or any sort of dermatitis, active acne, it's not good.
Okay.
Yeah. We have other treatments that are better.
And is there a membership for this? Like where you just, like a rotating
Well, they can buy a
appointment?
series of 3 treatments and they get 15% off.
Oh, wow.
So that does help.
It's amazing. Wow, my skin is like, feels amazing. It's like
Yeah, we haven't even
pulsating.
started either.
Wow.
So we're going to do cosmetic needling. She's actually going to go home with these 2 devices. So whatever she puts on her skin after she needles, it's going to go in a lot farther. So she gets about 4% of the product into her skin now. And when she needles, she's going to get more than 100 times the amount into the skin. So if you're working with hyaluronic acid, that's a big deal because it has, a large molecular structure. And when you needle, it can get into there. It creates all these little microchannels. So the product goes in much farther. And it's painless. And this is the only FDA-approved needling device. So this is a big deal because you can get a lot of devices that are not cut properly, that are too thick, that cause epidermal destruction. So you want to go with a reputable source, and Environ is a medical line. And we'll start on your cheek. And basically we want to do north and south, east and west, and diagonal. We want to cover all that surface area. It's imperative to do 3 directions. And it's a firm roll, not aggressive.
Doesn't hurt at all.
No, it
Feels
shouldn't.
amazing, actually.
You should never have it hurt. That one in, that needling device goes in 0.1, and then you graduate up to the 0.2, which is a 14 karat gold plated. It doesn't harbor any bacteria. This is a focus kit, and so this is going to go in 0.2. We're going to use this around the eye area, the glabella lines, and above the lip. This is more precise. When you have the larger roller, it's hard to get in those smaller areas. And this is more with a stamping motion. You can do right on the eyes, the brow bone. The nasolabial lines we can focus on as well.
I love how you could focus to the areas around the lips.
Yeah, and that's
You know?
the beauty of that, because a lot of people deal with the little lines around the lip line, and it helps when you have you know, a tool that can focus on that. So I'm actually going to do a lactic peel. So by manipulating it like this, it's actually going to increase the effectiveness of the peel. Go right up to that eye area. This is a peel that you will not peel from. It's a superficial peel. Peels run the gamut. So you have peels that you're going to peel, and you can peel significantly for 3 days. That's a medium depth peel that we offer here. Or a nice light peel where you won't have any downtime. It's beautiful glowing skin. Right down to her neck area. So because it is a lactic peel, it does need to be neutralized.
And skin damage could happen a long time, right? They say like whatever skin you were exposed to in your 20s could last a lifetime.
Yeah, a lot of the damage that you see coming out has happened a long time ago. That first sunburn that you ever had. And that's why it's extremely important to have vitamin A as the cornerstone of your regimen. A fat-soluble vitamin A, because that can actually protect your skin in the daytime from the sun and the harmful rays. So if you have that along with vitamin C, you're in good shape. You want the highest dose that your skin cells can handle. And you do a stepped approach to it. That means don't start off at the very highest dose. You risk a retinoid reaction. As your skin builds up receptors around the skin cells, it's able to take in more vitamin A. And then you're less likely to have a reaction. I'm going to put you right under the lights. We're going to do red light therapy. That will help induce collagen. It helps rapidly heal the skin, especially after the peel and the needling. And it helps with pigmentation, any sun damage, texture issues, any deficiency of the skin. Light therapy is very helpful.
I really feel my skin was dormant and now it's alive.
I'm going to put a peptide solution on your skin. Peptides are little protein fragments. They build collagen, they rejuvenate the skin, they help with pigmentation issues. And so because all those channels, those microchannels are open, this is our time to really feed the skin. Right up in the eye area. So in the serum that I talked to you about, the vitamin serum, it has your high dose of vitamin A, your fat soluble vitamin C, 20%. It does have peptides in there, a very high dose, and your antioxidants, like all in one. And that would be ideal for you to get started. So this is a vitamin treatment with antioxidants that I'm going to put on her skin. And then we're going to put the seaweed mask over. And that will firm the skin, hydrate the skin. It's a penetrant enhancer. So it will push anything that I have on the skin in farther.
Your skin is your largest organ for absorption, right?
Exactly.
You can feel it absorbing everything. It's amazing. But
And
first
now
if-
that we've created those channels, I mean, everything is supposed to get down, right down to the dermal layer. It's bypassing that top layer, the stratum corneum now. You naturally have a protective barrier there that doesn't let a lot in. We're breaching that barrier. Just keep your head down. Tuck it under. So this here is the alginate mask. It's a seaweed mask. And it will just calm any inflammation, rapidly heal the skin, hydrate and firm the skin, and push the vitamin treatment in farther. How does it feel?
Amazing.
The wonderful thing is it's all therapeutic. There's no fluff.
Mm-hmm.
And I think that's the difference maker. I mean, when you're dealing with medical facials versus spa facials,
Mm-hmm.
because I've worked in both. The medical facials, you're going to get results.
Right.
It's a results-driven treatment, and that's what we want. I'm gonna take this off. This is a fun one.
Wow.
Wonderful.
My skin feels amazing. Feels healthy,
Healthy.
youthful.
Mm-hmm. So if you had to just do, if you were on a limited budget and you wanted to get treatments done and you didn't know what treatment to get, doing microneedling is going to bring you a long way, even if it was 4 times a year. Than just getting a regular facial every month. You're going to see much better results with needling because it's inducing growth factors. It's addressing the issues in the skin with sun damage and extrinsic and intrinsic aging, acne scarring, texture issues. It's the most regenerative treatment that you can have.
That's what we want.
And then pairing that up with your own vitamins at home and needling are going to give you the best results. So Nancy, what do you think?
There is no comparison with a regular facial and what you just did.
Very
Wow.
therapeutic.
Rejuvenating. I mean, my skin feels alive. Amazing.
That's our goal. gorgeous glow.
Well, you have the hands that work the magic. Skin looks amazing. Looks so healthy. It's likable. So Jody, I have a question. Is this a good treatment for the summertime?
It's a fabulous treatment for the summertime because it doesn't affect that protective barrier. It actually builds that barrier with vitamin C and vitamin A, a fat-soluble form, lots of peptides and antioxidants, and it's resurfacing with lactic acid, so that's contributing to your ceramide level. So it's a facial that's very therapeutic, and it's also very beneficial in the summertime.
Now, I absolutely loved this procedure, and what happens if I want to do it every month?
You can do that. So the needling devices will change. So you're going to go home with the needling devices that we did today. And you're going to use a vitamin serum after the needling devices. That takes about a minute of your time at night. The next treatment, you'll go into a little bit stronger needling, but still no downtime. And then you do have a choice of going up a little bit higher to an intermediate needling, where you may have a little pinkness the next day, but nothing bad at all.
It's just amazing. It feels so good. And so if I come and do this every month, and then the next month we go up, and then...
Yep, we'll go up to the next level, and then we'll go up to the intermediate level on your third treatment, and that's where you want to stay.
Perfect. And if I come every month, then it lasts even longer.
Well,
Right,
you're
'cause
the thing of it is you're actually inducing collagen every time you do it, so it's long term. You know, we're not looking at just a quick fix. We're actually changing the way the cell functions.
I absolutely love it. It's amazing. Really, it's night and day from a regular facial. It's medicinal, it's anti-aging, rejuvenating, and it's healthy.
It's very healthy.
I love it. Thank you so much.
You're welcome.